We have people on respirators now in the hospitals, so can you
Sure.
go ahead?
We're continuing to follow up on all the reported cases, and since reported last, we had, I think, 6 cases yesterday. We have 14 new cases today. That includes 9 on Oahu, 2 on the Big Island, 2 on Maui, none on Kauai, and we're still looking at 1. Keep in mind that we get these reports, and some are only hours old before we were reported to you, so they're still collecting information on some of these. But you might be interested that on Oahu, 9 of the cases, all of the cases were Hawaii residents. They weren't visitors. Same's true on the Big Island. On Maui, 1 was a resident, 1 was a visitor, and again, we have 1 that we're continuing to evaluate, which I think reinforces the point that a lot of the virus that's being introduced is introduced as a result of Hawaii residents coming home, being exposed somewhere else and coming home. So that's continuing to be a...
Dr. Anderson, can I ask you to lift your mic up so the people online can hear? Thank you.
Okay, it's working today. Okay. Thank you. I hope they heard what I said. I won't repeat it unless you'd like me to. But let me tell you a little more about the lab testing. There's been, of course, a lot of discussion about that to date, and of course these numbers change by the hour. But today we have reports of a total of 5,747 lab results that have come into the state through both the clinical labs and our state lab. The clinical labs are doing the vast majority of the testing. That includes CLH and DLS. In fact, together they've tested so far 5,379 of the 5,747. Our state laboratories division, which serves as a reference laboratory, has tested 368 samples altogether, which includes samples that are being run to confirm private lab testing, but also the lab samples that we're using to the testing we're doing in our Sentinel survey. Dr. Park can talk more about that. You've heard about it, but we got another lot of 26 results back today. They're all negative. And the significance of that is that although we are now finding a few cases that seem to have be the result of localized transmission, no history of exposure to travelers or no history of travel to areas where COVID-19 is widely being disseminated. We don't believe it is now circulating widely in our community. Nevertheless, it's an indicator that it probably is being transmitted locally between people, and that's obviously a point of concern. Almost exclusively we're seeing the illness associated with travelers early in the course of this epidemic, and now we're beginning to see signs of local transmission, which only reinforces the need to implement very, very stringent measures to keep it from circulating widely in our community. And I think there are, of course, measures in place now that are effective in that way. Our social distancing is the objective with almost all these measures, but the restrictions on closures of bars, restaurants, and all the other things that are happening are, of course, supportive of that. And the main message everyone is getting is, stay at home if you can, work from home wherever that's possible, and don't expose yourself to others or be in a situation where you're going to be exposed. And I said this once, I think maybe last meeting, that it's rung well, and as I've heard others say it, and that is that if you should think about yourself as being infected, even if you're not, and that other people around you are also infected, and that way I think it helps to give you a sense of how serious this problem really is, and how we should be thinking about our movements and what we're doing every day. So that's the update on the cases and our lab support. We're going to be continuing to do what we are doing now, which is to aggressively pursue any cases that are identified. Again, these are usually identified. In fact, factor in all cases, now being identified by private physicians through private laboratory testing. I might add that the private labs are now able to do much of their testing locally. They may be splitting some samples to send to the mainland, which takes now over 10 days in some cases because of the backlog that laboratories in the mainland are having. But if they're done locally, they can turn the results around pretty quickly, sometimes in a day or two. Our laboratory is able to test and provide one-day turnaround times. If we get the sample before 11 in the morning, we're likely to be having the results by the end of the day. That's just for reference purposes. So if we get a report from a private lab that a person's positive and we confirm that, we can usually confirm it pretty quickly. But the front line in this epidemic are the physicians who are seeing patients who are symptomatic, and of course they're then referring them to us for follow-up, and that's really what we're doing now. I should add, I think you probably had others speak, or you're going to, on the 14-day quarantine. I'm sorry, have you had anyone from DOT or others come to talk to you about that? I don't want to repeat what they've said, but it seems like it's working. The numbers are way down on the people coming to us from other places, and there's some consideration now about banning or requiring 14-day quarantine for inter-island travel as well. I'm not sure if final decision's been made on that. I'm sure there are going to have to be exceptions to that if that is implemented, but that's being discussed. So that would essentially shut us off from other jurisdictions where the disease is occurring and help protect us against the importation of the disease. But it's certainly not going to help when the disease is already here, and we still need to go after any cases we have and contacts. That's what every other jurisdiction, every other state's doing. I think we're doing it better than most are. Our numbers are down. We're able to thoroughly investigate the cases that we know about and identify contacts, and of course they're being quarantined if they're close contacts. If the numbers get much bigger, we're going to have a much more difficult time managing that. But right now, I think we're doing pretty well. And I think that's helped to keep the numbers down, as it has been since this outbreak first occurred.